I'm Dr. Mounika Boppana, Consultant Medical Oncologist at KIMS Hospital, Secunderabad. March is the Colorectal Cancer Awareness Month. Colorectal cancer consists of cancers of the large intestine and the rectum and is the fifth leading cause of cancer-related deaths in India. The incidence of colorectal cancer in India is much lesser than that in Western countries. About 7 to 8 persons per 1 lakh population are diagnosed with colorectal cancer every year in India, and this is on the increasing trend. Alarmingly, it's being diagnosed in more and more younger individuals in their 20s and 30s. Changing dietary patterns like excessive consumption of red meats and processed foods and foods made of refined flour which are very low in fiber content, and lifestyle changes like having a sedentary lifestyle with minimal physical activity, increasing incidence of obesity, smoking and excess alcohol consumption have contributed to this increasing incidence of colorectal cancer in India, and also the fact that we are seeing more and more young individuals being affected by this disease. There is a hereditary form of colorectal cancer that affects multiple family members at a very young age. The symptoms of colorectal cancer include blood in stool, a recent change in the appearance or consistency of stool, recent change in bowel habits like constipation, a feeling of incomplete evacuation of the bowel or increased frequency of stool passage, abdominal pain, tenderness and bloating, feeling of a lump in the abdomen, unexplained fatigue, feeling of generalized weakness and unexplained anemia, and loss of appetite and weight loss, which occur in very advanced stages of the disease. Just like we have mammography to detect breast cancer early, there are screening tests to detect colon cancer early as well. Stool occult blood testing is a very simple, non-invasive test that looks for minute quantities of blood in your stool which may not be visible normally. If this test is positive, then we need to identify the source of bleeding by either doing a flexible sigmoidoscopy or a colonoscopy along with a thorough physical examination. Stool occult blood testing needs to be done by everyone after the age of 40 years, and it has to be done annually. Colonoscopy directly looks at the inside of the large intestine. Any abnormal appearing ulcers, polyps or masses are biopsied, and polyps as far as possible are removed because some of these polyps can turn into cancer a few years later. So colonoscopy is both diagnostic as well as therapeutic. Many Western countries, by implementing a strict colonoscopy screening program and polyp removal, have been able to reduce their incidences of colorectal cancer significantly over the past few years. All individuals above the age of 40 to 50 years have to get their first screening colonoscopy done. If it is completely normal, then the colonoscopy has to be repeated once in every 10 years. If there is an abnormality, then we might have to repeat it more frequently. People who have a very strong family history of colorectal cancer might have to start doing their screening colonoscopies at a much younger age. Screening colonoscopies can stop after the age of 70 to 80 years. When diagnosed early using a combination of surgery, chemotherapy and radiation, colorectal cancer can be completely cured. Lifestyle modification and dietary changes like reducing the consumption of red meats, processed foods and foods made of refined flour which are low in fiber content, increasing high fiber foods like fresh fruits, vegetables and whole grains in your diet, regular physical exercise and maintenance of an ideal body weight can significantly reduce the risk of colon cancer. The only way to conquer cancer is by having more and more awareness about it. Do not neglect the early warning signs and symptoms of cancer. Get annual stool examination and 10 yearly colonoscopies done on time. And in case of any further queries or assistance, the KIMS Oncology team is always at your service. Please don't hesitate to contact us at any time.